As nurses, we urge the public to make immediate and sustained efforts to resist the Trump administration's agenda to destroy global health. We have devoted our professional lives to improving public health, and we have an ethical obligation to speak out when we see threats to that goal.
Therefore, we must strongly oppose the current government's efforts to undermine and even destroy our work.
We object to the destruction of civil society, the assaults on science and the environment, and the terrorizing of vulnerable groups through a culture of bullying and cruelty that has no place in a decent world.
We object to direct threats to the nursing profession. These include plans to undermine the already desperate position of nurses in clinical practice through funding cuts and violation of labor rights.
We object to reported plans to eliminate funding for nursing research,
including for the already starving National Institute for Nursing Research.
We also reject the broader efforts to tear apart networks of health and social well-being, both within the United States and worldwide.
Medicare, Medicaid, and Social Security have lifted generations out of poverty and saved countless lives.
It is vital that these programs receive full funding. Indeed, Social Security could easily thrive by lifting the income cap on contributions.
And it is vital that a full range of health and social programs be fully funded, from those that address addiction and mental health to those that provide housing, food, and accurate health information.
Global health programs must receive full funding, including funding given through the World Health Organization and USAID,
which prevents millions from dying of diseases like malaria, AIDS, and the next pandemic.
It is vital that we stop regulatory changes that will accelerate the degradation of our planet, and that we continue to protect the safety of our food and water.
It is vital that government health institutions be led by qualified health professionals who are committed to science and public health.
Not by those who recklessly traffic in disinformation, spreading disease and worsening public health.
And it is vital to end government attacks on vulnerable populations, especially immigrants, children, and the LGBTQ+ community.
We must protect civilians, both nationally and internationally, from violence, terrorists, and school shooters. We should work for peace globally.
These threats imperil our health today and in the future, and they are absolutely unjustified.
The United States is the wealthiest and most powerful nation in the history of the world. We can share some soup.
The dismantling of society happens piece by piece. So each of us must resist when tyranny knocks at our door, including our neighbor's door.
Do not obey in advance by discriminating against the vulnerable and undermining their health and safety. Stand strong when ICE comes. Do what you can to keep them out of schools and healthcare facilities.
We urge everyone in the entire world to work against the anti-health agenda of the Trump administration, which threatens billions of lives. Speak out. Protest.
Call Congress, which has the power to stop this devastating reversal of public health progress.
Be strong. Be courageous. Protect the vulnerable, for they are first, and you are next.